This morning on how not to get sick, healthcare at a retail store. NBC's chief medical editor Nancy Snyderman is here with more. Dr. Nancy, good morning to you.
Good morning, Carl. This really has to do with these retail clinics that you see popping up all over the country. There are now 1,000 retail health clinics all over the United States. The question is, are they bringing added value or are they adding to an already complicated system? Imagine being able to pick up a gallon of milk, fill a prescription, and get a flu shot all in one place. You don't have to imagine anymore. This is reality. Health clinics are opening their doors while you shop. CVS's Minute Clinic is one of the many retail health clinics popping up in pharmacies, malls, and even grocery stores. In the last 9 years, they have logged over 3.4 million visits.
In general, patients come because they often have a wait in their physician's office. They don't have the convenience. It costs more. And for simple things, they want to be in and out.
The average wait in an emergency room is about 4 hours. It can take weeks to get an appointment in a doctor's office. But this system is not without its critics. The American Medical Association warns that these clinics should be closely monitored and should not take the place of primary care doctors.
The problem for regular care is that simple symptoms don't always mean one has simple diseases. So something like a high fever could be just a strep throat, but it could be meningitis, it could be pneumonia.
Although most clinics stick to minor or acute illnesses, some are starting to broaden their scope to include physicals and preventative care like diabetes and cholesterol screenings. Walmart's Solante Clinic in Orlando, Florida is run by doctors and is equipped to x-ray broken bones and handle other emergency care. Terrific for advocates who want better health care access and most likely a model for the future. It is very much a model for the future, but I should point out that CVS has a partnership with General Electric to administer health care benefits, and as you know, GE owns NBC. The full disclosure is out, Carl.
That's right. Nancy, let's bring in Jeffrey Kluger into our discussion. He's a senior editor at Time Magazine. He covered this topic in a recent issue. Jeffrey, good morning to you.
Good morning.
Do these clinics work?
They do work, and we have a piece up on Time.com just today that reports on a study in the Annals of Internal Medicine based on a Rand Institute study that surveyed clinics throughout, about 1,000 clinics throughout the state of Minnesota and elsewhere, looking into how well they treated the quality of care. And it was very competitive compared to doctor's offices, urgent care clinics, and emergency rooms.
Nancy, how about pricing?
Well, the pricing is really quite stunning. If you look at walking into one of these clinics, to see the doctor, to be evaluated, or to see the nurse practitioner, I should say, and to get treated, it's about $110. It's about like $160 some for doctor's office, well over $500, maybe $550, $575 for an emergency room. So that pricing really makes a difference. Now, I was saying to Jeff before we started, as a practicing physician 15 years ago, I found this quite painful.
Oh, it's taking away business, right?
Well, not like that. I really believe that the quality of care wasn't as good, that people would be passing out antibiotics for colds. And frankly, there is, I think, a slippery slope here.
Sure.
Come in, see me. Oh, by the way, here's the pharmacy, and don't forget to get your Band-Aids on the way out the door. There's an issue. However, the study in Minnesota was pretty good. Quality of care was the same. Money was good.
And Jeffrey, you point out that given all the problems we have with healthcare in this country, it would be nice if we could turn healthcare into an impulse purchase, right? The way you buy gum at the cash register.
That's exactly right. I like to say I hope people will pick up Time Magazine when they're at the cash register. And if you can also pick up a blood pressure test or a cholesterol test while you're there or over in the clinic, that way you catch these things early. As we know, prevention is everything.
But I think what Jeff says is very important. Pick up your blood pressure and your cholesterol tests. Do those things proactively. Don't go in sick. And my concern is people will use these as sick clinics and not as wellness clinics, and that's how they're designed.
Dr. Nancy Snyderman, Jeffrey Kluger, thank you to you both.
Thank you so much.
And it's a fabulous article.